Oh my God, Reshma. This is a mouthful, my dear. And we don't have, we should be doing a masterclass with you, Reshma. If you can unmute yourself and would love to hear your beautiful voice. Welcome, welcome.
Thank you, Lalita, and thank you for the wonderful introduction. Hi, everyone.
It is such a pleasure to have you, and I've heard multiple times about you, raving about you as your, she considers you as a mentor. But to me, I think you are unsung hero and a unsung heroine who has done so much for, the need of the underprivileged or the people who are probably not recognized and getting all the aids that they need to get, which is wonderful. I'm so thankful for that, first of all, and kudos to you. So, our topic today for discussion, Reshma, is health tech in emergencies. And I know we've got some really nice chosen queries for you. But before that, Reshma, I just want to hear a few words from you. How does it feel to be where you are? Because you're in combat all the time and you're like in threat all the time. How does it feel to do what you do?
Thank you, and it's been like almost 20 years.
Hmm.
So I think now being in the field for so long, I think it has become a very normal for you. So maybe it sounds very difficult, but then it's a difficult job indeed. But then it's a great level of satisfaction when you work for the people who are in need and who are actually going through this kind of crisis. So yes, still feel inspired, still feel motivated. A lot more to do, miles to go before I sleep. That's what I say to myself every day.
That is so phenomenal, and I know this is audio only podcast, but salutes to you, and kudos to all the work that you're doing. So, considering that we're talking about technology and how technology can be a great aid in emergencies, I'm going to start off asking you, what are some of the key challenges that you encounter? Because you, like you said, it is not an easy job where you are. There is always combat, there is always crisis situations, and you probably wake up knowing that there is a crisis situation to resolve. What are some of the key challenges that you encounter that you would kind of scale it up to be that level of challenges in introducing health tech in emergency response situations?
Right. So, like you said, that every day we woke up with an alert that there could be a possible crisis or a
Mm,
situation where
mm,
we have to urgently deal with. And when it comes to health tech, I must say before going into the challenges, because there are numerous challenges introducing health
mhm,
tech in emergency situations, but then
mhm,
I must state that health tech and the technology use of technologies in supporting the healthcare services is quite underutilized, is still not leveraged, be it for service delivery, be it for health promotion, education, disease prevention, treatment, or monitoring or surveillance, which is the main part of our job when it comes to health response. So
mhm,
it's quite underutilized, quite not leveraged so far,
mhm,
and I'm sure because of the numerous challenges, especially when we deal in an emergency situation, in a crisis situation, it's not easy. It's a very high stress environment that we operate in,
mhm,
and in a very difficult terrain. So introducing any health tech itself is very challenging, but we have made some good progress, and I must say that it has numerous advantages. It has a lot of benefits, and not doing the job in a traditional manner and in an old fashioned manner and introducing the technologies. I think it brings you great advantages. When we talk about the challenges, I think we need to consider the limited resources that we have most of the time and often when we operate in an emergency situation. So be it personal, be it time, be it infrastructure. The most common challenge that we face is the connectivity issues in the remote areas, that when we
mm,
know that this technologies requires a lot of network and the connection when
mm,
we deal with the data especially. So These are very common challenges that you don't have a trained personnel, for example. Even if you have a
Mm-hmm.
technology, we don't have, because again, these personnel, these staff, the emergency response team, what we call, is normally not trained on using the health tech or any sort of technology, because they come from a different background. So
Sure.
that team needs to be well trained and provided with the equipments which is also user friendly. Same time, we have seen some of the technologies introduced and the staff not trained enough, and then the results are very different. So these are some of the challenges. When yeah, we can talk about it when we move in the
Sure, sure,
conversation.
sure, absolutely. So, having introduced the challenges, where do you see, or how do you ensure, like if with the testings and the number of times you do it, anything comes with testing it many times? How do you ensure reliability and the effectiveness that is actually a working model and that it is helpful when you are using any of these health tech tools during emergencies?
Sure. I think, like I said, we have made some good progress in our different programs where we have introduced the technologies, and especially when it comes to health response. And when we start with very rigorous testing and validation process, which is normally not inbuilt. Um, we normally introduce the technology, but there is no enough testing or the validation which is done to have trial and errors and then to refix it. So I think
Mm-hmm.
that's something we have to ensure that it should undergo through proper testing and validation process, so that its reliability and effectiveness is measured. And if needed, then the issues or the limitations should be addressed properly. And then, like I
Sure.
said, the training and education of the emergency response team, again, to measure the effectiveness of these tools, because they are the one who are going to use it. So it's very essential. And then I think during the process, it is very important to also properly maintain and have troubleshooting done, or the protocols which is laid around that is followed. We see normally we contract a group or a team or an agency who introduce this technology, who's expert team of members, and then they are disappeared. And normally
Mm-hmm.
we don't
Mm-hmm.
have anyone to maintain it or troubleshoot it, or when it comes
Sure.
to modifying or adapting. Because in the emergency situation, what needs to be understood is that emergency situation is not the same, it evolves, and then you have to address the evolving needs of the communities, which means that the tools and the technology also have to be adapted. It cannot be the one which is designed at the first place. It has to be continuously evolving at the same time. So I think
Mm.
that maintenance, troubleshooting, uh, and regularly updating of the tools and the technology is mainly required. And then the normal protocols of data security and privacy measures, because it's
Sure.
most important and essential for us when we operate in an emergency situation, because this is the vulnerable population from which we collect the data. And for us, the protection of this population, affected population, is at the top priority. So we cannot afford at any point with any technology that the privacy and the data security is breached. So that's
Breached.
how
Okay.
we measure the reliability and effectiveness of any introduced technologies.
Fantastic, fantastic. And considering, thank you so much, Niruta and Shubham, for being active listeners. And if you really have something to contribute, would love to hear from you in the message box, and we can address it to Reshma. But while we're talking about it, so Reshma, as you said precisely, the effectiveness basically happens with the evolution of each of these technology aids that's provided and how it is conducive to the environment that you're working for. So previously you worked at Myanmar and now you're working in Afghanistan. So the terrain, the demographics, the people there, all of this needs to be taken into consideration, correct? So what are some of the main considerations where you're working right now in Afghanistan? What are some of the main considerations when you actually need to be thinking about when you're evolving in the process of choosing these health tech solutions, especially in Afghanistan? What, please, if you could be a little bit more specific to the terrains and the demographics there, that'll be awesome for our listeners.
Sure. I think we all know that Afghanistan is quite a mountainous region, and it has
Correct.
its own geographical challenges. It's a disaster-prone country. It's a landlocked country.
Mm,
It has a lot of limitation in terms of introducing any technologies, and now with the change in the regime, also we have to be extra careful and considerate introducing any sort of technology. So when it comes to Afghanistan, I think generally what we do is we work with the communities, we work with the stakeholders. We are now also working with the authorities, um, because I think that's also need of the hour to reach to the remotest population.
mm,
When we see that there's only one or just one single house on a mountain, and we have to reach to that family. Recently, we had faced like a lot of disasters in terms of earthquake, and now we have recently the flood situation across different provinces. So I think the communities and the stakeholders and the authorities are also coming forward to assess the needs and see if we can also reach out to the remotest population. So introducing any technology to reach out to the remotest population, I think, requires a lot of consultation within the community members and then the organizations and the bodies who are involved. So I would say for Afghanistan, I think that limitation in terms of connectivity, in terms of geography, in terms of reaching out to the remotest population, in terms of responding to the crisis, I think it's very important. And then there are like a lot of technologies which are now introduced when it comes to offline, for
mm,
example, tools. So
mm.
in one of the program, we have reached out to the remotest population, and we have managed to store, collect the data into that offline tool. And when we come back to a place where we have a network, or in the city, or in the center of the town, then we upload, and then we start processing and analyzing. So this is just one example, that
Sure.
using those offline tools and those kind of innovations are really needed, which can be scaled up and which has better effectiveness.
Excellent, excellent. And that kind of leads on to also kind of getting an understanding, as you so rightly said, that involving and engaging the local communities and the stakeholders is very critical. So Shubham here has a question for us, and he asks, what are some of the challenges that you face to win the trust of the locals, especially when you're going into a new place and you are a no person, I mean, a new face to them. How do you win their trust and tell them that you are a helper and that you are there to get aid for them, and how do you win their confidence? How do you do that, Reshma? I'm sure you're like really good in kind of bringing your positivity there, but how do you actually convince these people? Which is a very good question, by the way, Shubham. Thank you so much.
So no, thank you, Shubham. That's a good question. Um, I think winning the trust of the community is the most important part when you start working with any community. I think,
Mhm.
and that requires a very strategic approach, I must say. You need to work with the community leaders, I would say. So when we
Mhm.
start, if I go a little technical, we start with
Mhm.
a needs assessment exercise. It's a proper structured needs assessment exercise, which we do it through a very scientific tools and
Okay.
methods, where we start collecting the challenges, the specific needs, the vulnerabilities, the resources that local community already have. And we
Mm.
try to engage with the local leaders, the influential, the stakeholders who are really important within that community, and we know that they could be the change agent, and then they can go into deeper into the community, and then they can engage different people. So it's not just me or 1 or 2% from any organization goes, and like you said, we are still seen outsider, and
Mm.
when we go, we actually have to build that trust. And for which we require a small network of people first who are more influential and important within the community. And then
Mm,
you have to win their trust. And how do you do that? Like you said in my introduction, I worked with a lot of religious leaders, for an example.
mm,
So religious leaders in Afghanistan context are also very important and influential. So we try to work with these religious leaders and the influential people within the community, and then they are the ones who go and then work for us. So if they are
mm.
convinced, if they are on your side, and sometimes you have to talk in their language also. So
Sure.
recently I had a very interesting experience where we were trying to create a group, Village Saving Loan Association, and then there was some reference to the religious context, and that's how we try to navigate. So yeah, so it's to work with the community, you have to work with the leaders, influential people. You have to create those peers, change agents. Those are little educated, aware, motivated, interested, and that's how you spread within the community, and you start penetrating. You do stakeholder mapping exercise. So we have very scientific tools and methodologies to work within the communities, the outreach activities that we do. We need to understand the cultural sensitivity and bring that inclusivity factor. We build that feedback mechanism. So it's not just one way that we are going and we are the ones who know everything. We try to put them on the top of us and then try to get their feedback, and then start working with them in a very participatory manner, right from the planning to the decision making of any activity. Even if we have to introduce a technology, for example, we try to take their feedback into account right from the planning stage until it is finalized, and we keep on adapting as per their needs. And that's how that ownership is built. When you engage with the communities right from the start of what we want to do.
Excellent, excellent. Reshma, it's so lovely to actually listen to you because the calm and composure that you actually bring in with the conversation, not even seeing you physically, just your tone and how composed you are with trying to manage this whole thing, kind of gives me a feeler of how you would actually approach these leaders or these groups to win their confidence. And once again, girl, kudos to you for all that you're doing. So we are always, pressed on time for these 20-minute conversations, but I love it because it keeps us on our toes, and we're always like on our fingertips that we have to have our questions and our conversations. But final conversation, and before I let you go also, number one, I would like to understand, where do you see some of these potential future developments happening, or the trends in health tech that could further enhance some of these emergency healthcare delivery, number one. And number two, this is my personal question for you, Reshma, being a woman and being in combat, and being that you've been doing this for 2 decades now, I think you're a great inspiration, and we need more like you in that world. So give me the secret sauce of what makes you do what you do, and how do you get up to motivate yourself towards the end of the conversation. So the floor is all yours, girl.
Mhm. Thank you, Lalitha. Um, I think for the future development, again, I'm not a techie. I'm still learning every day, and it's a very rapidly changing field, and with lots of positive developments that's happening around the world. And this is something that I discuss with my team every single day. That let's keep that pace with the world, and let's not do the things in the old fashioned manner. It always helps to be on time. I think the future development and some of the things that's already introduced in the health field, and coming from that background, I would say that the telemedicine is now picking up, the remote
Mhm.
consultations for timely care, and especially in the emergency situation and the crisis response. I think that's something the remote consultations can be strengthened. I would say the AI, which is a buzz nowadays, is can actually help us in a lot of data analysis and help us in making an informed decision, I would say.
Mhm.
We have M-Health already introduced in our sector and in emergency response. I think
Okay.
M-Health I always say that it's quite underutilized. So something that has to be now promoted well, and again, as according to the needs of the organizations and within the communities that we are working with. Blockchain is something that now we are talking more for, again, secure data management and sharing, because that's again is one of the top policy that we have to maintain while working with this affected population. Drone something, but again very sensitive. But then it really helps in emergency transport and supply deliveries. But again, working in some of the fragile context, I would say it's very sensitive, and we need to have all the approvals working with the authorities. So that has to be
Mm.
kept in mind while introducing such technologies. And like in Afghanistan, we have a lot of disease outbreaks now and then. So predictive analytics and those kind of tools should be introduced so that we have the alert on time, and the emergency preparedness readiness team is actually prepared in the true sense, with all that surveillance that's effective enough to tell you that there could be an emergency. So that will help a lot. So um, and again, it's very very clear that the health tech and any sort of technology is going to change the world, and especially in the crisis situation and in the emergency response. I think it's just that there is no enough trained personnel, or the technology is introduced according to the needs. So I think I would encourage the health tech agencies and the groups and the startups to come forward and work with the humanitarian and development organizations, and
Mhm.
especially in the fragile context also, because like we said that this Afghanistan, for example, it's a very difficult terrain, and we need those sort of pilots and studies to be done, and we never know that we can change the entire ways of working in the future. um, and on your question, I would say that yeah, for me, I think that gives me kick. That gives me keeps me going on. I think now working in this context like Myanmar, Afghanistan, maybe my next mission would be. You never know, Yemen, Ukraine, Gaza. um, uh, that's going to be even more exciting, and I'm all set. And people like you, groups like you, give me a lot of energy, and also inspires me to learn every day new things and contribute in my field. So I think that's, again, like I said, miles to go before I sleep.
Well, I must say, this was music to my ears. What you just said in terms of, that energy and that zeal that you get every day, and that you have so much more to what you want to do, just shows me the drive that you want to be in this environment, and want to contribute a lot more. Which really, Menza listeners, I think today's conversation was very motivating, very inspiring, at the same time very informative too, in terms of how health tech or technology as an aid can be a great benefit to improving the health conditions in emergency situations and in comeback situations. So, Reshma, you are definitely an unsung hero who needs to be brought to limelight. And I'm sure Hikigai is going to do that for you also. We're going to bring you back for a masterclass soon, Reshma. So be ready for that. But until then, thank you so much. And Kajal, I know she's your mentor, but do you have anything, a little something to say that you carry as, as a sisterhood? What is that one thing that you carry as an inspiration and a mentorship from your sister? But that person who's a professional in front of you, who's always there in the combat, and she tells you that she's in a bunk or she's in a little place where that it requires a lot of security. What is that one thing that inspires you every day to keep going, listening to your sister? Kajal, unmute yourself
Yeah.
if you can, please. Yeah.
So Lalita, that one thing I would say is courage. Not
Excellent.
everyone has that courage to go and serve in such kind of situations.
Mm-hmm.
So yeah, that's really inspiring. And her joining today's podcast, I would say, is truly a special moment for me. Not only she is an incredible leader in her field, but she's also someone I've looked up to my entire life like a second mother. I'm both excited and honored to have had a share her insights with our audience today. Plus, it's always a joy to collaborate with family in such meaningful ways.
Fantastic, fantastic, Kajal. As always, she is my total, my buddy, I should say, and a big support. And we have so many listeners here today, Jitin, and we also have somebody else who kind of complimented on your comment, saying courage is most important in life. But guys, I think the only way you lead life going forward is to take the fear out of you and to be doing what you love to do and do it the way you want to do and have that passion and drive in what you do. So here's to all the Menza listeners: be your own health boss and continue to listen to Wellness Conversations with Smart Health. A very grateful and so much gratitude to you, Reshma, for doing what you do. Kudos to you, and keep up with all your good work, and we wish you all the very best and looking forward to bringing you back on board. And Menza listeners, thank you very much. Any closing remarks, Reshma?
Oh, thank you, Lalita, and thank you, Kajal. I think pleasure speaking to you all, and I think we all are contributing in our own ways, and let's not forget we are very blessed in what we have, and there's a lot more people who need our support. And yes, let's be courageous enough to go out and support. Even if you support one person a day, it means a lot. So yeah, thank you very much again, and thanks for having me. It's truly pleasure to speaking with all of you. All the best to Ikigai and all the men's listeners and group.
Thank you very much.